guys, and welcome back to the podcast. My name is Robbie Cassidy, and today we're going to look at scans and why a scan might not be the best option for you, as well as why in certain situations it can actually amplify the pain you feel and it can make things worse in some situations. So what I mean by a scan is really I'm looking at an MRI or an x-ray. In a lot of situations people get these to check out for ongoing pain or issues that they have. Now, in a lot of situations, they're exactly what you need to do, and they clear up a lot of issues and conditions, and they're huge for highlighting that. So I'm not going to speak completely against scans, but I'm going to talk about them against certain, certain conditions that I often see and why people get them versus why we need to look away from it and what the research says on a lot of them as well. Okay, why am I doing this podcast? Well, it's something that I see so often, and it's something that I want to put out a bit more information on, because what happens to a lot of people is that they get an injury. If the injuries are lasting a long time, they'll get a scan, and on that scan, it'll show up certain mechanical abnormalities that may or may not be contributing to the pain they're feeling. But once you see it on a scan, then you can connect that to your pain straight away. Okay, and depending on the language around what's used around and how you are, how you're shown what's happening, as well as how your physician speaks to you after it, or your physio speaks to you after, or your consultant even speaks to you after, can determine what course of action you take. And in a lot of situations, and this is one of the real reasons I want to do this podcast, is that the person will undergo surgery when conservative treatment would have actually been a better option. Okay, and that's why I really want to push this, and I kind of want to shed a small bit more light on it. Now, I do talk about it on Instagram a bit, so I'm just going to cover up a lot of the other issues there as well. Okay, so to jump into it, I'm going to look at MRIs and x-rays first. So I was actually talking to a friend last week, and he was saying that he had a bit of a back issue, and he had met a chiropractor. He was recommended a chiropractor, let's say. So he went down, and the first thing the chiropractor did was he did an x-ray of his whole spine, and from that then he determined what the best course of action was. Okay, now from the x-ray, the results that this guy got back were hips were offline, spinal disc height had reduced, so that's degenerative disc disease, and also some of his vertebrae weren't in line, so he needed to be adjusted. And then after looking at the scan, this guy got sold a 6 treatment course that he had to go through because it was the option to get things fixed. Now, when he said it to me after, to be honest, I was a bit shocked with the way it was handled and the fact that it was just straight in, get an x-ray, see what's wrong, and we need to get these things fixed. And now this is actually in Indonesia. So I find in certain situations in Indonesia, their medical system may be a small bit different to ours at home. And because of that, then they could be using older techniques. But it was actually an Australian doctor, I think. I think he was an Australian guy who was doing this. So I would feel that his knowledge should be of why they can be why they can be an issue. I think that's his knowledge should be up to date on that a small bit more. Not that the Indonesians is not by any means up to date, but it's definitely becoming more of a thing in Western world and Western medicine, or even let's say around Ireland, England, Australia is huge for it as well. USA is getting better for it. Why we need to look at the whole body and take more of a holistic approach as opposed to looking at it mechanically and then deciding what the best option is from that. Okay, so should you get an MRI? First off, I think that you completely depends on what your doctor or your physio says. So definitely follow their advice first. The reason I want to put out this podcast is that you may get a better understanding of what might pop up if the scan, before the scan even comes back. And that's huge, because if you have an idea of what it is, you will have a better understanding of how you can, or you'll have a better, understanding of how you can ask certain questions to determine if or not you should take a certain course of action. So it's an educational podcast just to give you that better idea. Okay, so if they're recommending a scan for certain conditions, then there's certain ones you need to look out for that need to be addressed. Okay, and a lot of these are common. Okay, first off, if you have non-specific lower back pain, and non-specific lower back pain, as exactly as it says on the tin, basically back pain, you can't really pick a point on it. It kind of comes and goes at times. You're feeling it when you're sitting down. It comes on randomly when you're at work and stuff like that. Now, if there's a certain set of symptoms and he's saying that you need to, or she is saying that you need to get it scanned, and you need to look at what possibly could be contributing, whether it's a malignancy or if there is a disc touching off a nerve or whatever it is. But if they're looking to get a scan because they feel you have degenerative disc disease, then, how do I put it nicely, you probably should look for a second opinion, because 50% of people over 30 years old have degenerative disc disease. So your scan can come back, and if someone picks out and says, okay, you have degenerative disc disease, you'll need to get surgery, or this is the cause of your pain. I just want to tell you 50% of people at 30 years old have degenerative disc disease with no symptoms or no pain at all. Okay, and that increases as we get older. So I think it's like 40% at 35, and then obviously then as you get older, it really goes up. And once you're over 50 years old, 55 years old, you're most likely to have degenerative disc disease. And it's a name that's put on something, but it's really the same. And a lot of these are, and you'll hear me saying this often, is that they're the same as having grey hair or wrinkles. They happen with age. It's just how the body, it's just what happens to the body. Now, if you have grey hair, doesn't mean that you're going to start getting headaches, or doesn't mean that you're going to start getting pain. Or same thing if you have wrinkles. It doesn't mean that you're going to, because you have wrinkles now, okay, you're determined, you're definitely having pain after that. So they're huge. With non-specific lower back pain, a lot of the time when you get your scan back, you'll see that it'll say degenerative disc disease, or in a lot of cases, you'll see a bulging disc on it. Okay, and this is another huge one. And when this happens, people connect to this and they lock into this bulging disc one. Okay, but to come back to the stats again, 40% of people at 30 years old have a bulging disc with no pain. So the bulging disc is most likely not the cause of your pain, unless it's really rubbing off a nerve. Then okay, you'll see that, and an MRI will report it. Your radiologist will say that underneath it, rubbing off nerve, that could be the cause. But if it's just a bulging disc at L5, or if you just have a bulging disc at L3, whatever it is, even in your neck, if you have a bulging disc, but it's not touching off something, it really doesn't make a difference. It's the exact same as having wrinkles or grey hair. And it's something that, the reason I push this so much is that so often clients come to me and they attribute their pain to these issues, and it's something that it takes weeks to really change their belief system around whether it's an issue or not. And I think that it's something that we need to get a better understanding of, the general population needs to get a better understanding of, so that these narratives aren't pushed so often. Now, and as I said, if you get that and you see it and you don't know what's causing your pain, you're just going to lock onto that, and that's the cause of it. Until that gets fixed, you have no other options, and that's so common. Now, the other ones that we have to look at are rotator cuff tears, shoulder labral injuries, hip labral injuries, and knee meniscus injuries, okay, to a certain degree. Now, rotator cuff tears are the same. There's research, a good bit of research back in the fact that they used to do a sham surgery where the surgeon just cut you and put a cut or an incision on your back, and then an actual surgery where they went in and they repaired the rotator cuff, and they looked at the people at a 3 month, 6 month, and 12 month, and there was no significant difference between the people who actually got a rotator cuff repair surgery or those who just got the sham surgery where they put an incision and they didn't do anything, they just stitched you back up again. So what does that say? What it basically, from my perspective, it's that when you look at the beliefs around these things, if you're going to connect certain issues to certain mechanical defects that you see on scans, then in a lot of cases, unless you go through a certain treatment, and this, I guess when you're looking at what treatment works and what doesn't work, there's so many factors. Has someone in your family got it before? Did it work for them? Do you know a friend that got it and has it worked for them? Do you know somebody who had a bulging disc and they had to quit their job because they couldn't work anymore? Okay, so there's all these other factors as well. They will determine your outcome in a lot of situations. So rotator cuff tears are the same. You're going to have those in a significant portion of the population and not have any symptoms. So why do some get symptoms and why do some other people not get symptoms? Well, there's a lot more to that. And I talk about that in good few other podcasts where I look at sensitivity, I look at the nervous system and how it adapts to it. I look at what other factors are attached to it. I also look at your activity levels. I look at your beliefs, what you feel is the cause, because that can be huge. And without taking care of all those other things, it doesn't make one blind bit of difference if you get surgery or not. That pain will still be there. Okay, so that's why it is important to have an understanding of what could show up. Shoulder labral injuries, other ones are cartilage injury in your shoulder. That's another big one. That you see. Hip labral injuries. This is a mad one. They found that 75% of people who play GAA will have a hip labral injury, so a cartilage injury in their hip, and no pain. That's 75%, 3/4 of the people who play. So why do some get pain and why do others not? Well, there's loads of other factors there, obviously. Okay, so I really want to push that. 75% of people who play GAA have a hip labral injury with no pain. Now that I say that, how many people do you know that had hip pain playing GAA but went and got surgery for it? And in Ireland, there's certain surgeons and there's certain people who are renowned for telling people they have bad hips as well, which I think is hilarious. So just go under the knife, get it fixed. Same thing is knee meniscus injuries. Now, knee cartilage injuries used to be a huge thing. If you got it, get in, get surgery, and you'd be back on the pitch. So much so that in the AFL, they were actually operating on people who didn't have pain but had knee cartilage injuries before, so that they could clear it out. And they were just getting these joint scopes and just clearing out the joint in young players, 18, 19 years old. So that is absolutely madness. It's crazy to do that, because you're going in and you're structurally affecting the person's body with no backing whether it's going to make a difference or not. So when we look at that, they find that 100%, when they looked at college basketball players, 100% of them had structural defects around the knee with no pain. Okay, the population that they picked out with college basketball players who were asymptomatic, who had no pain at all, they found that 100% of them had pain or had knee structural defects with no pain. So what does that say? I think what I'm trying to nail here, guys, is that the fact that something comes up on an MRI doesn't mean that that's the cause of your pain. There's a lot of other factors at play. Then when they started to look at adolescent sports players or sports people, 64% of them showed MRI structural defects in any joint with no pain. So chances are, if you go get a scan, you're going to have these structural defects anyway. Okay, so that's why I'm really pushing it, is that you don't, just because you have these structural defects doesn't mean that you have to go getting surgery. And really with the ones I'm talking about are the main ones, that your non-specific lower back pain, your rotator cuff tear, shoulder labral injuries, hip labral injuries, and knee meniscus injuries. Now, if you get an understanding of that and you go to your physio, you go to your consultant, and it shows that they push you for an MRI and it comes back and they're like, okay, right, this is the cause, let's go get surgery, and then we'll go conservative treatment for the next 3 to 5 months. and then we'll see how you are. I would always look to maybe get a second opinion on that, okay, an opposing opinion on it, because it's awful to see people out for 3 to 6 months after they get a surgery because they feel that they had to go through this and they miss a whole season so often. So why actually the MRI can be a bad idea? Well, as I said, you can get back pain, shoulder pain, knee pain, hip pain. You go get the MRI. It shows structural issues that are completely unrelated to the pain that you're getting. It's just showing that you have, may as well go in and get an MRI to show you wrinkles in a lot of situations. And then you start to attach certain beliefs to them. I have a bulging disc, so I can't play sports. Huge one that I often see. GA players with hip labral injuries, when they don't take care of the other side of things, and at 19 years old getting both hips scoped. Absolute madness. Looking at people getting knee surgery at 16 years old because they have meniscus damage, because their knee pain is kicking up. But they're not looking at the fact that they're training 6 to 7 days a week, sleeping 4 to 5 hours a night. Nervous system is on high alert because there's issues going on in the background, whether it be relationship issues or conflict, or maybe they don't even want to play the sport anymore. Loads of issues. They're trying to play at a higher level, or they're getting pushed to play at a higher level and they don't want to, they haven't the interest in doing it. All these other issues, but this is the cause of their knee pain, is because now they have meniscus injury. So when you go get a scan, depending on how your physician or your physio speaks to you about it, you can attach beliefs to those. And then these beliefs can end up causing huge problems after that down the road, in that you will avoid certain activities because of your past experiences. You're going to attribute certain pain. You're going to be overprotective in certain situations. You can catastrophize when something happens. All of these are massive issues. Then, until that structural defect is fixed, you're going to believe that you have problems. That's another massive one. Okay, and it's definitely a situation that a lot of my clients who come to me and we chat about it, they feel that, okay, well, I didn't want to run ever again, or I didn't want to go running or try running, even though I always wanted to run, let's say 10k, or I always wanted to run a half marathon or a marathon, because I got knee surgery when I was 16, 17 years old. And from whatever way they picked it up off of their physician or off of their physio, they said, if you keep running here, you'll need a knee replacement by 30 years old, 40 years old. What a load of shit. Sorry to say that, but that's so true. It's so common. Like, how can someone make that? How can someone just come out and just throw out a statement like that? You're going to need a replacement. Well, if someone in a white coat tells you you'll need a knee replacement at a certain age, a huge chance that you will need a knee replacement at a certain age, not because of the structural defects, but because of your belief in that you will need a knee replacement down the road. That's the danger. So I'm bullish on this, in that I really hate to see it. I really dislike seeing people push these narratives. And I think, to be honest, the majority of them now, or a lot of physios and a lot of doctors, are in line with that. They actually aren't pushing them as much, but there is still a subset who are pushing it a bit more, and they need to be. It needs to be, I suppose, it needs to be more education about what's going on and how to, or other forms of therapy or what else works. Because if there's not, they're just going to be pushing this all the time, and people are going to be setting limits on themselves from a young age and just stopping activity and not doing what they want to do because of these limits. So what is the solution? First off, I think if you know you're going in for a scan on a certain issue, now there is like ACL repair, PCL repair, stuff like that when you're looking at sports and getting back to sports, they are probably a better option for now from the research, for what we know. Maybe down the road that's completely thrown in the dump. In a lot of situations, like, the body has been adapting for thousands of years, so why has it changed now that we've figured out that an MRI can do scans for mechanical issues, and why do people have to start getting surgeries for issues that they didn't ever need them before? okay, so with, let's say, like ACL, PCL, I wouldn't be surprised if down the road they found out there was another option for that. Right now, though, it seems that when you're looking at getting back to high impact sports, that getting the surgery seems to be the best option at the moment. So I want to kind of dig through to kind of finish up this podcast, to wrap it up. What's the solution for these issues or these situations? Well, first off, you need to go in having an understanding what may show up. And I think that's down to your physio as well to talk you through what could show up and whether that's an issue or not if it does show up. That's huge. That's the first one. So if you have an understanding, that's massive. Then when the MRI comes back and they decide you're going to need to get surgical, you're going to need to go under the knife, or you're going to have a surgical procedure, ask enough questions as to if it is the exact cause of what your pain is, if it's the exact cause of what your issue is. Then make sure to get, after that, opposing opinions. So different opinions on it. And it may be that you have to reach out to a couple of different physios or a couple of different doctors to get different opinions on it. Because the last thing is you want to be going into a surgery that you don't need, spending 3 to 6 months rehabilitating that after, and having to believe for the rest of your life that you have a bad knee or a bad hip. Once you've that done and you've all those tried out, I would always push for a conservative treatment first. And a conservative treatment is where you're looking at strength and conditioning, you're looking at changing lifestyle factors, you're looking at working on the area and trying to achieve certain functional goals. If that doesn't work for you, and if you feel then after that you need to get a surgery, then I would push it. But that's only after you've gotten a couple of opposing opinions, you've tried out conservative treatment consistently, not just tried it out for 2 weeks or 3 weeks and just said, oh no, it'll be faster just to get the surgery and get this done. The difference between conservative treatment and surgery a lot of the time is, as I said at the start, when you get the surgery, you have to go through the rehab. Okay, when you don't get the surgery, it's kind of up to yourself a small bit more. And they're finding that's a lot of the time why these surgeries work, is that it's more of an issue that you have to go through the rehab, especially with like rotator cuff repair and stuff like that. So guys, I hope that gave you a better understanding of why scans are not the best option in a lot of situations. I hope now that you will, if you do get, if you are supposed to go for a scan, that you have a better idea of the questions that you need to ask your physio, as well as what's the exact cause. And then you have an understanding of, if you are going to get an MRI, what may show up. Then when you do figure that out, it's good to look for other opinions, opposing opinions, and see what either side are saying, what's the best option. Okay, I would really push conservative treatment in a lot of situations because it addresses a lot of the beliefs early on before actually having to get surgery and having to address those beliefs later on in life. Because that is everything I will talk about today. If you know somebody, let's say, that who's been recommended surgery for one of the issues that I've mentioned above, I'd love if you could send this podcast on to them, because you don't want to see somebody out for a full season, especially when you're looking at sports, because they feel that there's only one option. There's always another option with these conditions in these situations. If you have gotten surgery before for one of these issues, and I'm sure a lot of you have, what was your experience with it? Did you feel that, okay, surgery went well, I still have to follow through with my rehab, I still have to follow through with everything, and I'm in a good position now? Excellent. Do you find that you have certain beliefs around that area still? So do you feel that, okay, I have a bad knee, I have a bad shoulder, I have a bad back? And if so, what do you avoid because of that? Because that's really important. Sometimes we just set these limits on ourselves of what we avoid, activity-wise, sports-wise, because we feel that if we do, it's going to cause it to flare up again and get worse. So I want you to think about that, and it's something that I always challenge clients as well to think about, is what have you been avoiding because of this issue? And then slowly but surely progressing yourself back into it at a rate you're able to, as well as taking care of all the other aspects, is huge, because then that issue or that bad back or bad knee no longer bothers you, and your nervous system isn't overprotective of that area because of that. But that's all, guys. I'll leave you with today. Thank you so much for listening again. I'm delighted that I can see the podcast is growing. It's great to see. and it's thanks to you for sharing it and putting it on your story. That's huge. I really, really appreciate that. If you could also, I'd love if you could subscribe on iTunes and Spotify, because I think Spotify you can do it now, and add a rating as well, and a comment. It goes a long way with promoting the podcast. Lastly, I've been putting a lot more videos on YouTube, so I'd love if you go on YouTube, check them out. I'm going into a small bit more detail, let's say, on injury rehab, on sleep, and on taking care of the other lifestyle factors that could be contributing, so definitely check that out. That's Mobility Tutor on YouTube, and maybe subscribe to me on that, as well as TikTok. I'm starting to push TikTok a small bit more. It's definitely it's an interesting one, a lot to learn on it, but enjoying it at the moment. So that's all from me, guys. Really appreciate you listening in again. Thanks a million for everything, and I'll chat to you all again soon. Have a good one.